So we can connect our hip power and freedom to our feet. It's very crucial to release the calf muscles. And so we're going to go through a couple different positions to help facilitate the softening of the calf muscles. So I'm going to use the foam roller in a seated position. I'm going to place them underneath the calves, okay? And I'm going to do one side and then the other. Now this pressure on one side can be really intense. So if you feel like you can't put full pressure by lifting your hips, you can go ahead and just kind of slide your hips along the floor as you roll. Now, I'm starting with one side. I've got my other leg crossed over with the ankle on top of the other ankle. And as I go down, I'm going to roll from the ankle towards the knee, and then I'm going to turn and externally rotate. So now I'm on the outside of the calf. I'm going to roll from the outside of the upper calf at the knee down to the ankle, and then turn the foot in, roll from ankle to knee, turn the foot out, roll from the knee to the ankle. I'm going to do that probably about 4 or 5 times, nice and slow, okay, so that I can be really present with sensation, because when I move through challenging sensation, but it's really quick and my nervous system just gets alerted to a fight or flight response, it's not very effective at releasing these tight tissues, okay? So I'm rolling slow. I'm as present as I can with what I feel. And then I'm going to go to the other side, okay? Turn the foot in as you start down at the ankle, roll up to the knee, turn the foot out, and roll from the knee to the ankle. Turn in, roll from the ankle, foot to the knee, turn out, and roll from the calf down, or the knee down, to the ankle. Roll in from ankle to knee, turn out, knee to ankle, in, ankle to knee, and out, okay? And as on the other side, I'm taking some time to do it so that I'm not just shocking the nervous system by eliciting a discomfort response, trying to release it, but I'm slow, I'm present, and the nervous system knows if I'm present, if I'm connected to my breath, there is a safety in letting go of the guarding, okay? So that just gave me some good movement to create some glide, to just work through some bound tissue. And then I like to do a position of hold. Now, with a roller, it can be a little challenging to get the uppermost parts of your calf. However, as we've talked about before, when we release any portions along a fascial line, when we release it, it helps to decrease the tension along shared links of fascia. So with the roller here, I'm going to get that lower part of my calf, and this is a really nice way to release some of the tension in your calves. Another option, if you want to get higher up to that superficial muscle of your gastroc, because that feels tighter for you, take another mat roll and you can tuck that higher up toward the fold of your knee, so you're getting more of your gastroc, okay? I really like this position because that lower muscle of the soleus, one, it tends to be quite tight in certainly myself and a lot of people, but as well, having more blood flow to the soleus is actually really helpful because your soleus muscle is this amazing muscle that actually has pumps within it that help improve the flow of your lymphatic system, which is essentially the fluid of your immune system. So releasing the soleus muscles actually has an element of improving your immunity, oddly enough. It helps regulate blood sugar when you're activating your soleus as well. So it's a really nice muscle to release. But again, that gastroc, that superficial large calf muscle tends to get tight as well. And that's where you would use a mat roll closer to the fold of your knees. And as always, noticing the flow of your breath Nice, slow exhale, feeling the inhaling breath respond slowly yet more fully as you more completely release on your exhale. And take a few more breaths to just really allow these tissues to soften and settle and your nervous system to adjust, and accept that despite the discomfort, we can start to release this guarding. All right, so taking a seat, okay, you can be in just kind of a relaxed cross-leg position, and just kind of feel your feet a little bit more, right? Now we have more of a connection from our feet through the legs, so that we are going to continue to make better contact between the feet and the hips when we start to wake up and soften the legs, the calves and the thigh in between. So just enjoy that there's a sense of kind of greater ease and relaxation. And you're probably noticing that you can feel the continuity between your hips and your feet as you start to open things up through the legs.